Okay, so this is going to be the introduction of the issue. So first off here, just a projection of the United States increase in demand for healthcare professionals over the past 30 years has grown significantly. As you can see here, the world as a whole by 2030 will be experiencing a 50 million person doctor worldwide shortage when it comes to healthcare professionals. Smaller cities with less money, smaller economies such as Albuquerque are a great sample for the problem because they're showing huge shortages with large growth in populations. New Mexico is suffering more than most states. We usually routinely come in at the bottom. Right now, we have a shortage of about 90,000 doctors, and by 2030, that number should reach 120,000. So the fewer doctors lead to a less healthy general public and future issues and health risks for future generations if things are left untreated. So common practices can be implemented to slow down the issue, and healthcare providers must be creative in their problem solving in trying to find this issue. Next here is going to be a list of the national statistics. As you can see here, there's a list of the United states based on percentage of shortage based on the population. So as you can see, New Mexico, right there at the bottom, when I did a little bit more research, I did find out that New Mexico is actually currently at the absolute bottom of this list when it comes to shortage. As you can see here on the right, it's going to be a list of the occupational percentages based on their growth. And as you can see, there's going to be significant growth, as we've always seen with the healthcare shortage, and this is just going to lead to further shortages and more widespread issues. Here's going to be a list of the main problems here causing the shortage. So the first one is going to be that New Mexico has a very high population of Medicare patients, and Medicare patients, unfortunately, doctors are not paid as much for working with these people as traditional insurance. So it's harder to pay our doctors competitive salaries as compared to other states with lower populations of Medicare patients. Another issue is just the New Mexico economy as a whole. We have a relatively small economy, and since 2017, we've had no Fortune 500 companies in the U.S. That were centralized here in New Mexico. Another issue is schooling. When we're trying to recruit healthcare professionals, their children usually come with them, and they will have to attend our schools. And New Mexico is routinely at the bottom of the country's standardized testing, as well as the bottom of the worst public school systems in the United States, just based on several factors. And lastly, the number of violent crimes committed in New Mexico. We are kind of known as the Wild West, and it also makes recruiting large populations of healthcare professionals a little bit difficult. So here's going to be a list of the basic steps that can be taken to kind of limit the issue that we're currently facing. And the first thing is going to be something called grouping, which is just grouping doctors together and having them work together as opposed to working individually. Grouping of 3 doctors who usually work individually can increase the amount of patients seen by the 3 of them by over 300% than each one would be able to do individually. So that's something that's definitely a bright spot that can be utilized. Another thing is going to be hiring advanced practice clinicians like nurse practitioners, physician assistants, and this creates access for patients. Even if we don't have quite as many primary care physicians, patients are still able to talk to someone and get the help that they need. And then lastly, it's just going to be making New Mexico more inviting to the healthcare professionals. This can be done by tax breaks, strengthening our economy, obviously. And then the number one is going to be decreasing violent crime. Overall, just making New Mexico a little bit more safe and a little bit more stable. Our plan here is broken down by the amount of time that we're wanting to complete each step in. So within the first 6 months, we're wanting to increase the number of advanced clinicians per hospital and urgent care. That's going to be nurse practitioners and physician's assistants. Within 1 year, wanting to implement tax breaks for the hospitals actually hiring those advanced clinicians. And then also begin grouping single personnel practices to increase efficiency. So single doctor, urgent cares, or hospitals, combining them to create a more efficient system. And then within 5 years, we're wanting to decrease New Mexico crime, mainly focusing on violent crimes, and then increase our school reputation with a slightly increased education budget, which is already something we need. And then again, last thing is going to be an economic stimulation through upper class movement to New Mexico, and this is just going to be caused by bringing in a larger number of doctors, which is going to increase the average
yearly income for Albuquerque residents, which is therefore going to boost our economy. So here's going to be our budget for this proposition. It's broken down from least expensive to most expensive, least expensive being at the top and most expensive being down at the bottom in green. So the first least expensive option is going to be a tax break for corporations, increasing the percentage, which would make it financially irresponsible for these companies, hospitals included, to not follow the proposed protocol. Next up is going to be $150,000 to hire protocol inspectors for the Albuquerque hospitals. Next is going to be $200,000 per hospital to hire advanced clinicians, like I said previously, such as nurse practitioners and physician's assistants. And then over the next 5 years, a stimulus package for the Albuquerque area's economy, which would reach probably into the $10 to $15 million range. Here we're going to have our costs and benefits. Here on the left is going to be our costs first. The first two are breaking down the cost to a hospital of hiring a doctor and a advanced clinician. Next up is going to be the small tax break that we're giving for hospitals. This would be done by the government here in New Mexico, discovering kind of what that percentage would be. Next up is going to be the grouping protocol and the inspectors that are needed to enforce that protocol, which is going to be around the $50,000 range. And then the combination of single doctor firms to create groupings should be a very cheap alternative. That shouldn't cost the state anything. Here on the benefit side, we're seeing that a doctor can average see 20 patients a day. With one advanced clinician, they can reduce the workload by 10%, which basically means more customers and more patients coming through the door, which means more money for the hospital. Single hospital productivity will increase, and then individual doctors will have fewer patients, which will mean they'll have more time to spend with each patient, not making them rush through or anything. And then lastly, the cost of the hospitals will be minimized. Most of the cost will be on the state. In conclusion, the population in New Mexico continues to rise rapidly while our number of healthcare professionals is already dwindling. Healthcare is a human right, and everybody should have that readily available and be able to use it at any time. There are no current plans in place to solve this growing problem here in the Albuquerque area. And the state's economy is very obviously struggling, and an increase in wealthy people and businesses brought in by this proposition could have a very positive impact on Albuquerque.